Why I picked engineering? I took an aptitude test in high school, and it told me to be all these things. That I was like, okay, I can do this, like, yeah. But then I thought, I really can challenge myself a lot more, and that's why I went into industrial engineering, because it still had the same concepts of trying to use aspects of business and in the corporate world to make things better, but you were an engineer.
So like Vanessa, I took an aptitude test in high school. Mine told me that I should be a nature guide or a chimney sweep. I think that's because I answered all the questions that I really like being outside a lot, but that wasn't really where I saw my career taking me necessarily. I only did engineering initially because I liked math and science, but I think getting into those initial classes and seeing that it wasn't just math and science, but it's how you're applying it to problem solving. That was really motivating for me and really interesting. Being able to design things and solve problems and use math and science and logic and problem solving in an applicable and creative way.
Why do you love working at the intersection of IE and healthcare?
Well, I love applying engineering to healthcare because it's something new, it's something different, and I think it's something that I'm really passionate about. I think being able to see changes that we've made improve patients' lives is something that's really cool and really rewarding and really motivating me to do good work in the future. And I've gotten to read even emails that patients have sent in to the Cancer Center about how they've seen changes in the processes that they're experiencing, and just being able to read it from a patient perspective, especially working with cancer patients, it's really impactful to read letters about people being appreciative about the work that you've done, improving their care, and giving them a better chance at life. It's huge.
I think another quality about being in this environment is being a little bit bold. I mean, all the time you have to go into a new environment for, say, observations. Like, we have to collect data. We have to do a time study at the lab. Do you remember when we did that? Literally, we're just more or less foraging into this new environment, people doing their lab stuff, and we're like, hi, we're the industrial engineers.
If you're the type of person that really wants to work in healthcare and wants to make a difference in the world, but doesn't necessarily want to spend 7 years going to med school, healthcare engineering is definitely the place for you. It gives you so much opportunity to apply engineering skills and principles in the field of healthcare, and every single day you're able to see your labor put into practice and really see it come to fruition.
What's the coolest thing you've gotten to do while working in IE in the healthcare field? Hang out with the doctors in the emergency department at like 2 in the morning.
The coolest thing I've gotten to do is working with a lot of awesome different people from the healthcare system. So doctors, program directors, residents, med students, nurses. Oh yeah, so occasionally we do go into the operating room,
Crazy fun.
No, it is crazy fun. When you think of when I was in high school and I thought of the word engineering, like, it was such a fuzzy concept. Like, so do you build
Yeah, I had
things?
no idea what it was.
Right, yeah, like you build things. Like my dad wasn't an engineer, he had never told me what that was, and I just assumed it's like, you tinker on computers or you like make a bridge, but there's so many different aspects of it, especially with industrial engineering and especially applied to healthcare. Healthcare is such a complicated, complex world, and it hasn't really been touched by people like us that have a systems background, and so it's going to be very interesting to see how we can apply our skills and our tools to make that very complicated world much easier.